Hey, Sean Hannity here with a highlight from my radio show today, right here on iHeartRadio.
This is the Sean Hannity Show.
Here's today's iHeartRadio highlight from the Randy Rhoads Show.
All right, News Roundup, Information Overload Hour. It is the Sean Hannity Show. Toll free, our telephone number is 800-941-SEAN if you want to be a part of the program. Don't forget, at the bottom of this hour, we're going to be joined by the owner, president, CEO of MBI Energy Services. They have, look, I spoke to the guy earlier. Let me put it this way. He says he is looking to hire hundreds of people at good-paying jobs, and they're even willing to train people. And these jobs, you know, many of them are six-figure salary jobs. That's all I can tell you. So if you're suffering from bad policies of your government, you want to join me and we want to get America back to work, or at least those of you that are nice enough to listen to this program, there are opportunities out there. The unemployment rate in that state is 2.6%. He actually told me the unemployment rate he thinks is zero in North Dakota. In other words, if you want to work, you're working. So he's got opportunities, and he said, look, well, if you can get me a couple of hundred drivers right now, they'll be paid $80 to $100,000 a year. I said, you got to be kidding me. And that's, by the way, this is a career where you can make lots of money, great benefits. So anyway, it's all part of Hannity getting America back to work. It's on our website if you want to check it out. But the next half hour, we're going to hit that and hit that hard. In the meantime, look at everything on Obamacare today. 2/3 of the American people say the truth would have killed Obamacare. Obama says, you know what? Signing up for Obamacare is just part of growing up, being a good little socialist. Moody's threatens to downgrade insurers over Obamacare. Landrieu's polls are plunging in Louisiana. So what does she do? Obamacare disappears from her website. New York Times, Obamacare driving doctors out of private practice. Nancy Pelosi, though, insisting that our founding fathers would totally support Obamacare. And then we have the issue of the shameless power grab and the lawlessness that exists with the president just changing the law willy-nilly. Now, one of the things that we have been highlighting is, all right, what is the alternative to this? Well, we have two people that are very familiar with an alternative that would actually work, and it's not government top-down. We have Dr. Benjamin Carson is with us, Fox News contributor, Congressman James Lankford of Oklahoma. Gentlemen, welcome back to the program.
Thank you. Good to be with you.
All right, Congressman Lankford, I know you've cued in Dr. Carson. You've got a plan how we can solve this mess. What is it?
Yeah, the multitude of plans to be able to come after this. One of the things that we need to do is be able to get more authority back to the states to make decisions. That's how our federalist system works, is that things that are not specifically given to the federal government are given to the states. We have 8 states that have already requested what they call a health care compact. This is a constitutional process. It comes from Article 1, Section 10, Clause 3. That allows states to be able to make compacts with each other. 8 states have said, give us, that is the state, the authority to make all health care decisions in our state, and we will manage the health care for all of our people. As Utah, Oklahoma, Texas, Missouri, Indiana, Alabama, Georgia, South Carolina, their legislature and their governor have already signed this compact and made the request to the federal government. I'm leading the effort from the federal government side to respond back to those 8 states and to say you can run it. So it basically allows those 8 states to get out of Obamacare and everything else. For the other states, I say to them, if you like your Obamacare, you can keep it. But for other folks that don't, they can get out of it.
So in other words, like New York and New Jersey and Pennsylvania and California, they can keep it all they want. They've ruined everything else in these states. Illinois, I guess we can put in there as well. And then anybody that has some decency and common sense and they want to get off Obamacare, they'd have the choice. What is the support like this in Congress for this? What is
the support's actually growing very fast. Obviously, the legislators from those 8 states want to see that happen. My push on this is allow the laboratory of the states to actually take off on this. It's a Daniel Chapter 1 principle. To find out if this is going to work, let them be able to run it, and then I think every other state is going to say, we want the same flexibility that those 8 states have. But this is the first step of it.
What would it do in real terms for real people, let's say in Oklahoma? We'll start there in your state.
Sure. Our state of Oklahoma already has Medicaid authority, as every state does. Every state manages their own Medicaid for the poor and the indigent in their state. This would say back to that state, they have Medicare, Medicaid, S-CHIP for children, and all the Obamacare requirements. All the federal dollars that are typically allotted to those will instead come to the state, and the state then makes the decision on how they're going to take care of their own people. The state will do this much more efficiently. They'll have much greater access to physicians because physicians are fleeing from Medicare right now and would much rather deal with a state plan without all those federal regulations attached to it.
You think people will save money? Will they have their choice back? In other words, will they be able to buy the plan from Blue Cross, Blue Shield, Aetna, United Healthcare, any plan that they want? Can they buy across state lines? Can they take it from job to job? What about pre-existing conditions?
All of those states get a chance to work all those details out. Here's the nice part about a healthcare compact. If you're a state like Vermont and you want a single-payer system and you think that's going to be such a great idea, you could do that system if you wanted to. That's your state's responsibility to make it. In Oklahoma, we're going to have free market solutions. We're going to bring in greater competition. We're going to try to open this market up and to give greater access to individuals. We would do that in Oklahoma, and it would benefit our folks greatly. If Vermont wants to experiment with a single-payer system, they can have at it and do that as well. It doesn't define to the state how to run it in their state. It says to the state, you have the ability to make the decision. That's the way it should be.
Dr. Carson, if you read the New York Times, Obamacare is driving doctors out of private practice. You spent most of your life. You're a gifted surgeon. You're a brilliant doctor. I've gotten to know you personally. You got a great bedside manner as well. What are the doctors that are still in medicine telling you? Is that true? Obamacare driving doctors out of private practice?
I have a very difficult time finding any doctors anywhere that are happy right now. They're looking for ways to get out, looking for alternatives. And, I love what Congressman Lankford has put forth here, talking about, rights, individual rights and state rights. If you look back at the Constitution, Article 1, Section 10, it talks about the fact that the states are the ones who have the right to regulate health care, not the federal government. This is the very thing that the founders were afraid of, and it's happening right now. This is a wonderful alternative. It makes excellent sense. It gives us the ability to work. There's a number, the president's fond of saying there are no other plans. There are plenty of other plans. And opportunities for people to try some of the other things and see what works, and not just simply sit there and try to impose their will on everybody. This is where the resistance will come from, those who want control and the ability to impose their will.
Dr. Carson, I've been talking to a lot of my friends that are in medicine. Now, many of them are bypassing the government, by partnering with hospitals because hospitals get to charge more for different services. And the second part of their practice tends to be moving towards more concierge care. In other words, they are appealing to people that have the money or the policies that can pay them outright for their services. You see that too?
That's happening in spades. And what, the danger, of course, is that the federal government will come in and say, but you have to see these patients, and your license will be contingent upon you seeing them. So as long as we continue to allow them to get away with these things, they will do it. They will push to the limit. And that's why we have to have some kind of resistance here. And I'm hopeful that Congressman Lankford and some of his other colleagues will recognize that, the reason that we have divided government is to prevent excessive rights by particularly the executive.
By the way, I want people to know, because some people may say that doesn't sound possible, that the government would mandate by law that doctors must see patients, even those that cannot pay. But the reality is, right now, the way the system is set up, that government, through Medicare, Medicaid, they dictate what a doctor can charge for a visit. It's very low. Most doctors can't even keep their lights on. If they did this full time, they'd never be able to even keep their lights on and keep any services going at all. So,
right. And because licenses are things that are government approved, then they have the ability to regulate you. And, they're starting to do this with universities, with all kinds of things. They're saying you must meet certain standards that they set, of course, and they can set them any way that they want.
So right now,
they give them the ability to control everything.
So basically now they dictate what doctors can and cannot charge for services, even though the doctors are forced into a business model that loses them money. Now you're saying that they're going to be forced to see patients even though they can't pay. That doesn't sound like a free society anymore.
No, and Sean, let me add one thing to that as well, and that is if a doctor were to see a patient that can't even afford the Medicare rates and wants to actually charge them less and say, okay, let's make a separate deal and I'll just charge you a few dollars because I want to take care of you as someone who needs help, that's against the law as well. They can't do that. They can actually be kicked out of Medicare for actually charging less than Medicare to some people that they want to be able to help. So they are trapped in a system that is fully government controlled, both up and down.
Dr.
Correct.
Carson, go ahead.
Well, interestingly enough, you'll have a hard time believing this, but my mother told me 35 years ago that the government's ultimate aim was to make doctors government employees. And she was trying to say, are you sure you want to do this? She was happy that I was going to medicine, but she said, this is what the government is going to try to do.
By the way, is that the same mother that took away your TV and made you read every day?
Exactly.
Yeah, that's a very wise woman, Dr. Carson. I think she's way ahead of her time.
Oh, without question, way ahead. And I wish a lot of other mothers would look at her example, because she absolutely refused to be a victim, always felt that there was something that you could do, and made sure that we felt that way, too. And if you take somebody who has the can-do attitude, you can put them in virtually any environment, and they will thrive. And you put somebody with the victim's attitude, and they will find a way to blame everybody else.
Yeah. Why do I think, Congressman Lankford, that the fiercest resistance is going to come from government itself and the bureaucracy itself, because that's where their power comes from? And if they were to allow states like Oklahoma and your state and these 8 other states to break away and do their own thing because they know what's best for the people in their state, that would take away a lot of federal control, wouldn't it?
It is, actually. And what Dr. Carson was saying is absolutely correct. This is about power and control. This is not about options and taking care of patients and relationships with doctors. This is about a group of people in Washington trying to decide for the rest of the nation exactly how things should work, and it's how they think things should work. Yeah. And the most basic thing that you would have is a relationship between a doctor and a patient and a family through some of the most difficult decisions they'll ever make in their life. They want a federal bureaucrat in the middle of it because they feel like they'll make wiser decisions. I absolutely disagree. States can do this. Families and doctors can do this. They should be allowed to do it. It will be a more efficient system. And for every time I've had someone say, but can states really pull this off and to do it, I say, would you look at just a moment at the federal structure right now and how things are going with the website and with the fraud in Medicare and Medicaid and all the problems that are happening? You're telling me the federal government's doing a good job? Yeah. I'm telling you the states can do much better at this than the federal government.
The federal government that gave us $17 trillion in debt, the federal government that bankrupted Social Security and never put the money in a lockbox, the same people that have $90 trillion in unfunded liabilities. What does it say, Dr. Carson, that the President of the United States knew and his office knew, and they debated internally? You can look at the November 2nd, 2013 Wall Street Journal. It chronicled the whole episode, but they were debating internally in the White House whether to tell the American people that you're not going to be able to keep your plan, you're not going to be able to keep your doctor. But yet they decided not to tell the American people the truth. Now the Fox News poll shows nearly 2/3 say the truth at that time would have killed Obamacare. What does that say?
The fundamental dishonesty of that is very alarming. But, of course, this is what happens when you have a media that picks sides. And I've been telling members of the media, I told a couple of senior editors at a major newspaper, when you guys pick sides, what you do is enable the side that you pick to ignore laws, to ignore Constitution, to ignore everything. And you have a responsibility. The news media has absolutely neglected its responsibility.
Yeah, I mean, it seems to me that when the government lies, finally people are waking up to it, but now we're stuck with it. Congressman Lankford. Go ahead. What?
No, I said a lot of people are waking up. You know, I've been just thoroughly impressed as I've been traveling around the country recently with incredible crowds. And people want to come out and they want to hear common sense, and they really resonate with it. I'm absolutely certain that people are waking up.
Yeah. Well, are you going to run for president?
I'm going to continue to help people wake up. That's for sure.
Did I ask you if you're going to help people wake up? I didn't ask you that question. You know, I asked you if you're going to run for president.
We'll see what the good Lord has to say and what the people have to say.
Well, have you asked him yet? Did he give you an answer? I mean, you know.
No, I haven't had a definitive answer. But even if I did have a definitive answer,
you're not going to tell me.
I wouldn't announce this early. Why would I give them all that extra time to pick at me?
Yeah, that's true. Well, some of God's greatest gifts are unanswered prayers. Garth Brooks wrote a song about it. All right, guys, good to talk to you both. Appreciate it.
Thanks, Sean.
All right. There you have it. There are answers. Does anyone want a solution except what the government's ramming down your throat?
For more of the Sean Hannity Show, go to Hannity.com.